Thank you for joining us for part 4 of the series. During this presentation, we will be covering the different treatment options, the pros and cons of each, and if each one is right for you. As always, you may download the slides so you can reference them at any time throughout this presentation. In this section, we'll cover steps for deciding on your treatment. First, it is important to research your options and to figure out what treatments are available for your cancer and its stage. You can start with some research online by reading trusted websites and books, and by attending webinars like this one to become fully informed. Your doctor will also talk to you about your options, and don't be afraid to ask questions. There's no such thing as too many questions, as it is your right to have a complete understanding of your options. Then once you feel you understand your options, you should weigh the benefits with the risks to decide which treatments fall within your goals. So you should look at the side effects and decide whether they'll be worth enduring or just too much to handle. Also, how will each treatment affect your physical and mental well-being? So for physical, what are the physical costs of each treatment, both temporary and long-term? Some treatments can cause pain that you might not be willing to endure. Some might even irreversibly change your body. Living with pain can have a major impact on your life, so physical side effects are important things to consider. Then for mental health, how will each treatment affect your mind and emotions? Will certain options take such a toll on your body that you will lose the ability to be independent? Will your energy levels plummet? Some treatments also can have direct effects, like chemo brain, which can cause fatigue, depression, and mental fog. Mental health is not something to be overlooked and should be another important factor in your decision. And then for financial costs, investigate what types of treatment will be covered by your insurance. If a treatment or part of a treatment isn't covered, can you afford it? Finally, consider how treatment will affect your everyday life. Will you need to take days or weeks off work? How will your role in your family change? Will you need to travel for your treatment? Some cancer treatments are very intensive and may take over your life. This might be best for one person, but someone else might rather choose an option that allows them to stay home with their family and continue to work. Choosing a treatment plan is not an easy decision, but understand that there are no right or wrong answers. Every patient and their cancer is different. Ultimately, it is your choice. Now, for the rest of the presentation, we will cover different treatment options and the pros and cons of each. We will be covering 4 common types of treatment: radiation, surgery, chemo, and immunotherapy. We will then go over different treatment approaches, including options for clinical trials, foregoing treatment, palliative care, complementary and alternative medicine, and rehabilitation programs. First, we have radiation therapy. It is one of the most common treatments for cancer, with more than half of cancer patients getting it, either by itself or along with other treatments. So it uses high-energy particles or waves to destroy or damage cancer cells, and it can be administered in several different ways. So some forms of therapy use a machine that directs beams of radiation into your body. These usually take about 30 minutes, 5 times per week, spread out over several weeks. There are also options for injections or catheters. It depends on your cancer and what your doctor thinks is best. So we're going to go over the pros and cons of each treatment. To start, here are some of the benefits of radiation. So radiation therapy is one of the most popular forms of treatment because of its ability to kill cancer cells and prevent tumors from growing. Radiation can also work alone or with other forms of therapy. So for example, it is common to undergo radiation to shrink a tumor, then have surgery to remove it completely. One of the most notable benefits is that it is an outpatient treatment. This means that you go for treatment during the day, but don't have to stay at a hospital. It usually lasts no more than 30 minutes a session, so you can still enjoy your life at home, go to work, and visit with friends. While you will feel no pain when receiving treatment, there are side effects that will likely occur later. These most often include fatigue, skin irritation at the place where radiation was administered, and loss of appetite. Although side effects vary greatly from person to person, and some may experience no side effects at all. The other con of radiation therapy is the inconvenience of it. While it is an advantage that you will not have to stay at a hospital and it will take less than 30 minutes, you will have to go in for treatment often. It depends on your treatment plan, but it is common for the treatment to be delivered 5 days a week for 1 or 2 months. This may be especially difficult for the rural population. Your closest treatment center may be up to hours away. Having to make the trek there and back every day will be very inconvenient, and you may have to take off work or miss other activities to be able to get your treatment. Overall, radiation therapy is a very common choice for many patients, and it has been proven to be very effective. With its proven track record and ability to stay out of the hospital, this can be a great choice to treat your cancer. Another common type of cancer treatment is surgery. So this is most often used on solid tumors that are contained in one area. Usually not used for cancers that have already spread. So depending on your cancer and how advanced it is, surgery may be used to remove the entire tumor or remove some of the tumor to help other treatments work better. Most people with cancer will have some type of surgery, so it can be used in addition to other forms of treatment or as a standalone if your cancer is contained in a small area. Surgery can be an excellent option if you have a single mass or tumor, because it has the potential ability to remove all cancer cells in a small area, meaning you can be cured with surgery alone. It is also relatively convenient for patients, as the surgery is performed once over the course of a day while the patient is asleep. Unlike radiation, you will not need to go in for treatment every day for weeks on end. There are some significant risks with surgery, so surgeons are highly trained and will do everything they can to prevent problems during surgery, but sometimes problems still do occur. There's always a risk that a surgery could go wrong or have complications caused by the surgery itself, drugs used, or just your overall health. Generally speaking, the more complex the surgery is, the greater the risks of side effects. So some of the most common problems are just pain and infection. After surgery, most people will have pain in the part of the body that was operated on. Your doctor or nurse can help you manage this pain after surgery, so be sure to talk with them about a pain management plan before they operate. There is also a risk of infection after surgery. To help prevent this, follow your nurse's instructions about caring for the area where you had surgery. Overall, surgery is an excellent option as a standalone treatment if your cancer is still contained in one area. If it has spread, surgery can still be used along with treatments. The next option is chemotherapy. This is a treatment that uses chemical agents to destroy cancer cells. It is typically administered through a vein, by mouth, or into a muscle. In early stage cancer, surgery will often be performed with the intention of curing the disease, and then that is often followed by chemo to reduce the risk of reoccurrence. In the case of advanced stage cancer, the aim of chemo treatment is to control the cancer by controlling the symptoms. Now for some pros of chemotherapy. So in early stages, chemo can completely kill the cancer cells and cure you completely. Other times, chemotherapy is useful at controlling late-stage cancers and by slowing down the spread or shrinking cancer cells. Finally, a major advantage of chemo is its ability to travel throughout the body and attack widespread cancers. In comparison, surgery and radiation are confined to treat only one area. Now there are some risks with chemo. So first, chemotherapy can come with some pretty harsh side effects. Chemo drugs can't tell the difference between cancer cells and healthy cells. So when healthy cells are destroyed, you may have significant side effects like hair loss, nausea, vomiting, anemia, fatigue, and memory problems. Your cancer cells may also mutate and become resistant to chemo, making it ineffective in treating your cancer. Finally, you will have to go to a lot of appointments. Chemo is most often given as an infusion into a vein, often at an outpatient chemotherapy unit or in a doctor's office or hospital. It can also be given as a pill, shot, or cream, depending on your type of cancer. But no matter what method, you will have to see your doctor often so they can administer the drug and monitor your cancer. Like we talked about for radiation, this can be challenging, especially for our rural viewers. You might have to travel hours just to get this treatment, which can be a very inconvenient and tiring thing. Overall, chemo is a common treatment for many cancer patients, and it is effective, but it will take a major toll on your body, and the side effects may be difficult to deal with. The fourth option we will present to you is immunotherapy. So this is a bit of a newer option because while the idea of immunotherapy to treat cancer has been around since the late 19th century, the FDA did not approve the first treatment until 2010. But while new, it has become a very effective form of treatment as it uses your own immune system to fight your cancer. Immunotherapy basically boosts or changes how the immune system works so that it can find, target, and attack cancer cells. It may be used as a standalone treatment or as a supplemental therapy to just give your immune system a boost. Immunotherapy can be administered through an IV or catheter at an outpatient clinic or hospital, or sometimes through creams or pills at home. Depending on the type and stage of your cancer, treatment can be given daily, weekly, or monthly. It can also sometimes be given in cycles, so a period of treatment and then a period of rest. Now for the pros of immunotherapy. First, it is accessible and non-invasive. I know many of our listeners are members of the National Grange, so many of you live in rural areas. Like we talked about earlier, a major problem for the rural population is access to treatment. So you might have to drive hours just to get to the nearest treatment center. The good news is that immunotherapy sometimes can come in oral or topical forms. So you may not have to go all that way to a treatment center. Because they can be oral or topical, they are also non-invasive. You will not need to be poked by a needle or undergo any painful treatment. Just take a pill or apply some cream at home. Immunotherapy also comes with minimal side effects. It is different than chemotherapy because it only creates a stronger immune response that can kill cancer cells, but it does not harm any healthy cells. And chemotherapy kills cancer cells, but also kills healthy cells. So the side effects can be very different. Finally, you can develop immunomemory. So immunotherapy can offer the possibility for long-term cancer remission. It can train the immune system to remember the cancer cells so that if they ever come back, it knows right away to attack them. Like all treatments, there are some risks involved with immunotherapy. While we mentioned on the last slide that side effects are often less severe than other treatments, there still is the possibility for some. You may experience flu-like symptoms, weight gain, stuffiness, or swelling, but most people report these lessening after the first dose. It is also important to note that immunotherapy may take longer to work than other treatments. You will undergo regular checkups, blood tests, and scans to see whether the cancer has responded, but many people have a delayed response, so it may take a while to know whether the immunotherapy has worked. Like all treatments, it may not work. Right now, immunotherapy works for less than half of the people who try it. Or you might have a partial response. Your body might also get used to it. So even if the treatment works at first, your tumor could start to grow again. Immunotherapy is a great option to be used on its own or as a supplemental treatment. If you are thinking about going with this option, be sure to weigh the pros and cons and talk to your doctor about all the different types and options. The last 4 treatment options have been standard options available to anyone. Now we'll move into some alternative approaches and ways to manage your cancer and side effects. The first option is a clinical trial. So these are research studies that involve volunteers. They help doctors find better treatments for cancer. So what are clinical trials? There are clinical trials for every type of cancer for any stage. This is the way drugs or treatments are approved for standard use. They can study a new drug like a type of chemo or immunotherapy, a new way of doing surgery, or a combination of treatments. They are very safe as the government has very strict rules to protect people in a clinical trial. But they are completely voluntary. If you are eligible and your doctor approves, you may join one. Some of the benefits of participating in a clinical trial can include that you can try a new treatment that is not yet available to everyone. Maybe nothing else has worked for you, so this might be your best chance. Maybe you just want to try something new, knowing that there is a possibility you will benefit. You will also get care from medical experts at leading hospitals and health centers during your clinical trial. You'll likely see your cancer care team more often so that they can monitor your cancer and check for side effects. Finally, by participating in a clinical trial, you might help others who have the same disease by helping to advance cancer research. For centuries, medical treatments have been tested on people, and their participation has saved lives today. Your help in a trial may give a person suffering from the same disease in 20 years a better chance. Of course, with clinical trials, there are potential risks. As a newer treatment, it will not have been as studied and tested as much as standard ones. This means that there may be unknown side effects that could be worse than standard treatments. You also may need to have more doctor visits or testing, which require more time and travel. Like I mentioned earlier, if you live in a rural area, this may be especially difficult. Your nearest treatment center may be hours away, and your team will want to monitor and test you frequently. The constant driving back and forth could become very inconvenient and tiring. Again, clinical trials are untested. Options like chemo have been studied for years, so we have a better sense of who it will work on and how it will work. With clinical trials, there is no way to know who it will work on, so even if you hear stories where it is effective on one person, it just may not be on you. So is participating in a clinical trial right for you? Like all other treatments, it is completely up to you. There are so many clinical trials out there, so it is hard to group them all into one category. Each one is different and comes with its own benefits and risks. The most important thing is that you are completely informed. You can find out which clinical trials are available to you and talk it over with your doctor. It is ultimately your choice. You can choose to participate knowing it could help you and others in the future, or you can choose to stick with an already tested and predictable standard treatment. Next, we have the option to forego treatment. So some people may choose not to have treatment at all. So what do I mean by no treatment? So basically, you would just choose not to have any treatment at all. You wouldn't do chemo, radiation, immunotherapy, none of it. So it is completely up to you. Your doctors may recommend treatment, but you have every right to refuse. Sometimes people with very advanced cancers find they'd rather treat the pain and other side effects so that they can make the best of the time they have remaining. Others might choose to forego treatment if their treatment options all cause pain that they just do not want to endure. While choosing to forego treatment can be a very daunting path, there are reasons it might be right for some. First, you can avoid spending days in treatment centers and hospitals, and instead spend your time with your loved ones into doing the things you enjoy. Without treatments, you will only need to go to the doctor for them to monitor your cancer's progression or for pain management options. There are many options for this pain management. You can do palliative, hospice, or home care, all topics we'll get into in later slides. Finally, without treatment, there is little to no financial cost. If this is a big worry for you and your family, choosing to forego treatment may be something to consider. But also know that many treatments are covered by insurance, so be sure to look into all your options before making your decision. Of course, the biggest con for refusing treatment is the shortened life expectancy. You would be accepting the natural progression of your cancer. So with no treatments to slow or kill the cancer, it will take its course and likely spread to other parts of your body. Every cancer is different, so you may live for months or for years. It depends on the stage and type of your cancer. It may also be hard for loved ones to accept. They might have different opinions for how to treat your cancer, but it is ultimately your decision, and it is important to be a self-advocate, a topic we will cover in later sections. Maybe your cancer just can't be cured, or maybe you just don't want to endure the side effects of treatments. Either way, this is an option. You do not have to think of it as giving up. You can think about it as choosing to avoid side effects and manage your pain. There are many options for pain management that may offer you your best quality of life. Finally, choosing to forego treatment is not a decision written in stone. At any point, you may change your mind and choose a new treatment to try. It is all up to you. The next few treatment approaches can be used to treat pain if you do choose to forego treatment, or it can be used to treat pain and side effects from your treatment. First, we have palliative care. This is a form of pain management that's main purpose is to improve your quality of life. So what is palliative care? Basically, it treats symptoms and side effects of cancer and its treatment. It is a very common part of cancer care. It is usually recommended to everyone. It focuses on easing symptoms like nausea, pain, fatigue, and shortness of breath. It also helps you manage the stress of cancer by helping you handle the emotional side of the disease. Treatments may include medicine, nutrition therapy, physical therapy, or even relaxation techniques like deep breathing. You may also be offered emotional and spiritual counseling, as well as practical help to manage insurance, legal, or employment issues. One form of palliative care is CAM, standing for Complementary and Alternative Medicine. These are medical products that are not part of standard medical care. CAM can come in two forms, complementary or alternative practices. Complementary is a form of medicine or practice that is used in addition to standard treatments. Alternative is used as a form of treatment in place of standard ones like chemo or radiation. CAM is usually split into three main categories. The first is mind-body therapies. These include things like meditation, yoga, and acupuncture, all meant to relax your mind and body. These are more often used as supplemental treatments to help with side effects and relieve pain. The second type is biologically based practices. These include vitamins, herbs, and special diets, all substances that will hopefully help your body deal with side effects or just keep you healthier in general. The third type of CAM is known as manipulative and body-based practices and can include things like massage, chiropractic care, and reflexology. These are all practices that manipulate or move one or more parts of the body to achieve healing. Many of these options are excellent ways to relieve side effects and ease stress. Certain vitamins, diets, and practices can significantly help with staying healthy and with pain management. There are also many options that work to relieve stress. Having cancer and going through treatment can be a very stressful time, so it is good to have options to help you feel calm and ease worries. Think massage, meditation, and yoga. Using CAM can also help you feel in control. This is something you choose to do yourself, and you have full control over which diet you want to try, how often you do exercises, or which vitamins you will take. Of course, talk all these through with your doctor, but this time you can experiment and try different methods to help you feel better. There are some CAM options that do come with risks. First, many treatments are unproven, so you might see ads or hear from friends that this special diet will change your life or that these herbs will relieve all pain. There is a lot of misinformation out there, and many options you might hear about are not significantly studied or backed by science. Just be sure to do your research and make sure what you choose to do will do more good than harm, because some options can in fact be harmful. Try to avoid anything that does not have proven results or at least be proven to not have harmful results. Certain supplements can even interfere with your standard treatment, causing more symptoms or making your treatment less effective. When choosing CAM treatments, work closely with your doctor. You may seek out your own CAM treatments, but be sure to tell your doctor everything that you are trying and confirm that it will not interfere with your standard treatment. Also, look for red flags. Be suspicious of any treatment that says it can cure your cancer. There is no current CAM treatment that has been proven to cure cancer. Also, be suspicious if a treatment does not have any side effects. If it were studied properly in clinical trials, side effects would be seen. Also, be suspicious of promoters who attack the scientific community or tell you not to use a standard medical treatment. Beware of personal stories that claim amazing results but provide no actual scientific evidence. Basically, do your research. Find out about the training and education of anyone supporting the treatment or using it to treat you. They should have a history in the medical field and would be most trusted if they are experts in cancer care or complementary medicines. Find out whether scientific studies or clinical trials have studied the treatment in people and what side effects have been reported. CAM treatments can be a great option that the majority of cancer patients do use at one point. Whether it's a special diet, massages, or yoga, many CAM treatments can help keep you healthy and relieve stress. As long as you do your research and consult your doctor, using a CAM treatment can be very beneficial. Finally, we have rehabilitation programs. These aren't exactly treatments, just ways to help you stay healthy and well before, during, or after treatment. Cancer rehabilitation programs help people with cancer maintain and restore physical and emotional well-being, and it may help you experience a fuller or quicker recovery. The goal is to improve your ability to function and to keep you as active and independent as possible. You will work with professionals trained in the specific area of rehabilitation that you need, and they will make a personalized rehabilitation plan for you. They may include therapy techniques, exercises, or assistive devices. You may need only a few appointments, or you may need it several times a week for several weeks or months. Appointments typically last 1 to 2 hours, and it's at an outpatient treatment center. It is a great and very common treatment approach, and really the only downside is that it will take up your time. Most people leave each appointment feeling better than when they came in, and it will help you with your recovery. As you make your treatment decision, here are some last things to consider when choosing. First, we want to emphasize that we are not recommending one treatment over another. There is no 100% right or wrong answer. Your choice of treatment is completely dependent on your goals and your cancer. Everyone is different, and any option could be right for someone, but not for another. Second, you can change your mind. Even when you make a decision on your treatment when you are first diagnosed, you can change your mind and switch or stop at any point. Again, everything is up to you and under your control. Third, take your time. While you may want to jump in right away after a diagnosis to choose a treatment, there is often no extreme rush. Do your research, ask questions, get a second or third opinion, and don't make a decision until you feel ready to. Finally, seek support. It is helpful for many people to talk through their options with family or friends you trust. Of course, it is ultimately your decision, but many do want to get others' input. We are not recommending one treatment plan over another. What is right for you depends on your goals and your cancer. Ultimately, it is your choice. Thank you so much for joining us today as we have gone through cancer treatment options. We hope you learned something useful today during this part 4 of our 6-part series. So far, we have gone through how to prepare ahead of time, tools to help with the diagnosis, making goals, and now treatment options. Up next is part 5.